Hi, my name's Ellie, and today I'm going to be doing my intradermal OSCE. So we do intradermal injections. So today we're going to be using lignocaine. We use lignocaine, and it just goes in the very top surface of the very top layer of the skin, and this helps numb the site of injection for an IV cannulation. So firstly, I've got my PPE on, so I've got my gloves, my glasses, and my correct uniform on. And I want to gain consent from my patient before I go any further with this injection. So I'm firstly going to explain the procedure and what we use it for. So I'm going to say that it's this tiny little needle, so it's going to be a 27 gauge needle, very little, and we're not going to go any bigger than a 25. And it just goes in the very top surface of the skin, and we push the lignocaine in. It stings a little bit, but it's going to numb the site, and it's going to form a little bleb. And then hopefully they're going to say, yeah, okay. And so we'll get some consent from them. And then we want to check for allergies. So are they allergic to any medications? Are they allergic to lignocaine? Have they had lignocaine before? Are they allergic to any anesthetics? That kind of thing. So if they're not allergic to any medicines and they're not allergic to lignocaine, then we can go ahead with the injection. So you can give lignocaine between 0.5 milliliters and 1.5 milliliters for an adult. So we're going to give 1.5 milliliters of lignocaine. So we want to drug check our lignocaine before we draw it up. So I'm going to get my crew partner to read it out, and then I'm going to read it out. So it's lignocaine 1% in 10 mils, and it expires in June 2020. Cool. So firstly, we're going to clean the site of injection. So we're going to use the aseptic technique. So we're going to start from the middle and work our way outwards. And we're not going to go over the site and re-dirty it. So we want to stay sanitary and clean. And then we are going to get our 3 ml syringe. We're only using a little one because we're only drawing up a smaller amount. I'm going to attach this to my drawing up needle. And then I'm going to say sharps out. And then I'm going to get my medication. And I want to draw up a little bit more than 1.5. So I can get rid of any air that may appear. Okay, so I'm going to recap my drawing up needle, not my sharp needle, and then I'm going to aspirate to get rid of any air. Not aspirate, but I'm going to get rid of any air and make sure it's up to 1.5 milliliters, and then I'm going to get my crew partner to check that. And then I'm going to take my drawing up needle off and I pop it in my sharps container. And then I'm going to attach my sharp needle. And I'm going to decap that, so it's going to say sharps out again. And then I don't want to touch the site where I'm going to inject it. So I want to inject the lignocaine very near the site of the vein where I'm cannulating, but I don't want to go in the vein. So I'm just going very near it. I'm going at a 15-degree angle. So sharp scratch. And then if I pull it up, I can see that I'm in the very top level. So I firstly want to aspirate to make sure that I'm not in the vein. So I can see no blood being drawn back, so I know that I'm not in the vein. And then I just want to slowly inject it. And I'm forming a little bleb on the surface of the skin. Obviously this is a sponge, so it's not going to show the bleb, but in a real patient we would see the bleb forming on the top. Once I've fully injected it, I'm going to remove the needle and I'm going to pop it straight in the sharps container, which is here. And then I'm going to document the time. So it is 4:30, and it's the 21st of June. Oh, sorry, not 21st of June. 21st of August 2019, and I'm going to document that we've given 1.5 milliliters of 1% lignocaine, and we're also going to just continue reassessing our patient, checking that they're not having any allergic reaction to the lignocaine, and then about a minute after we've injected the lignocaine, it should be numb and we can cannulate our patient.